Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, sharing, and rating. Once again, welcome to the Health Flow Podcast. Are you thinking about starting your own podcast? If so, Anchor is the easiest way to make a podcast. Let me explain. Number one, Anchor is free. Anchor has all the creation tools that allow you to record your podcast and edit it right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, Google Podcasts, and many more. You can make money from your podcast with no minimum listenership. Anchor is everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. Good morning and welcome to the Health Flow Podcast. I'm your host, Jean Armand. I hope you all are doing well. Welcome to episode number 54. I've been off for about 2 weeks. Well, not off, but just been really busy at work. Work has really picked up. It's busy, and I just busy, and then also just busy trying to establish some personal goals. I I don't know if you guys remember that I am a cyclist. Yes, I do cycle. Started about 5 to 6 years ago. One of the best things I've ever done. I enjoy it. And last year, with my good friend, I went to London and participated in the Prudential Ride in London last July. And in that event, I rode 75 miles. I went in with like, I'm just going to see how much I can do. And then as the ride went on, I really wanted to do 100 miles. But then I saw at around the 75th mile, there was a really nasty fall. A gentleman took a really bad fall. And I just lost my motivation and just stopped. So this year, I'm like, that 100 miles is really still on me. So, along with a friend, um, another cyclist, Dr. Reginald Nesbitt, which he's been on many one of my podcasts, and also my brother. I said to my brother, I want to do it, and he was down. Now, my brother is, you heard him from episode number 36 on pulmonary embolism, avid cyclist. Like he's really good. I look up to him. He's been riding for years. So he was like, sure, I'll come down and I'll ride with you. So our ride is set for the end of October. So I have to train. And now I'm putting it out there. I'm really going to have to train and be motivated. Um, and I would do that anyway. So welcome back to the Health Flow Podcast. I'm going to talk briefly about, September is National Prostate Cancer Awareness. So I'm going to discuss that. And I just want to put the disclaimer out there that, the information is just to increase your knowledge. It is not to diagnose or treat. You still need to go out and see your doctor and follow your physician's advice. So just to give you some facts, and there's no way in this short time I can cover everything on prostate cancer, but at least the basics. I'll give you the basics. Prostate cancer is the most common cancer among men after skin cancer. So skin cancer is the most common, and then prostate cancer. And where is your prostate? The prostate is below the bladder, but in front of your rectum. As a man ages, the prostate gets larger. When a young man's in his 20s, his prostate was probably the size of a walnut. But as he ages, it just gets bigger. Almost all prostate cancers develop from the prostate gland cells, and that's why it's called adenocarcinoma of the prostate. There are other types of prostate cancer that exist that don't start from the cells of the prostate gland, but those other types are rare, and I'm not going to go through those now. Risk factors for prostate cancer. So one thing, your age. So prostate cancer risk increases after age 50. And then men age 65 and older, there's about 6 to 10 cases of prostate cancer found in men who are 65 and older. Prostate cancer develops more often in African American male and Caribbean men of African descent. African descent. Prostate cancer develops less often in the Asian American and Hispanic and Latino men. And really the cause is unclear. Prostate cancer appears to have some genetic component, even though we're not, the studies is not 100%, but there is a strong genetic component. Having a father or a brother with prostate cancer doubles a man's risk for developing prostate cancer. So if your father or your brother has prostate cancer, has had it, your risk is double. There are still men without a family history that develop prostate cancer, obviously. Other risk factors that develop aren't very clear, but they include, number one, your diet. And I thought this was very interesting. Men who eat a lot of dairy products seem to have a slightly higher chance of getting prostate cancer. Studies suggest that increased calcium level with food or supplements have a higher risk in prostate cancer. So that's something. Slow down on the dairy. Obesity. Now, I did a topic on obesity, and obesity affects our health in so many ways. So your chance for cancer increases with prostate cancer if you're severely overweight. Smoking, we've talked about this again, smoking increase the risk of prostate cancer and even increase your risk of dying from prostate cancer. Because as you know, prostate cancer, very treatable, early detection, very treatable. It's not a cancer that anyone really should die for if we're having our annual checkups and really staying on top of our health. Studies have also shown that there are some chemical exposures that firefighters, and I thought this was interesting, and if you know anybody out there that's a firefighter, they need to be more diligent, because studies show that the chemicals that firefighters use may increase the risk of prostate cancer. Other studies have also been linked with Agent Orange as a risk factor for prostate cancer. So your firefighters friends out there, share this information with them, that the chemicals they use increase their risk for prostate cancer. Now, prostatitis, which is really the itis at the end, is inflammation of the prostate gland, and that also increased the risk of prostate cancer. So those are your risk factors. Now, how does someone check for prostate cancer? So to begin with, let's talk about the digital rectal exam that a lot of people are painful, are not people, men. Certain men are very concerned and afraid of doing this for a multitude of reasons I'm not even going to discuss right now. I just want to tell you how it's done. So it is something many men fear. So what it is, with a gloved, lubricated finger, um, the healthcare provider insert the finger into the rectum, and what they're doing is feeling for any bumps or hard areas on the prostate that may cause cancer. I know what I was taught, if I'm remembering correctly, it should feel like the tip of your nose, the smoothness to the tip of your nose. So it shouldn't be hard. You shouldn't have bumps. It should just have that smooth texture when you examine the prostate to the tip of your nose. So if there's bumps or hardness, that may indicate something going on with your prostate. So it's a simple exam and a very simple and helpful. And you should be getting that over a certain age. Once you get to be 40 and older, that should be done every year with your primary care doctor. Signs and symptoms of prostate cancer. Some signs and symptoms are difficulty urinating or a slow or weak urinary stream, especially at night. Blood in the urine or semen, trouble with erectile dysfunction, pain in your hips, your spine, your ribs, just pain in your lower back. Those are all signs. Weakness or numbness in the legs or feet, or loss of bladder or bowel control. All of a sudden you can't hold your urine when you used to be able to hold your urine. Another way that prostate cancer can be detected is by doing the prostate screening. So your prostate specific antigen, the PSA, I'm sure you've heard of that. The PSA is a blood done by a blood test. And if you're a man age 50, which and your PSA is less than 2.5, then you're at average risk, and you may need just to retest it every 2 years. If or when the first time at age 50 your PSA is tested and it is greater than 2.5, then every year that man should be getting their prostate checked. The prostate cancer grows slowly. It really does. It grows slowly. So to be clear, how are you going to, if you have, don't wait, because this is what I see happen all the time. We're waiting. This should be part, if you're a man, I would say African-American male, 45 years and older, your doctor should be doing a digital rectal exam, which they're checking to make sure there's no bumps or hardness, and making sure that it's smooth. You should have, if you're age 50, you should get your PSA checked. If your PSA is less than 2.5, the PSA is the prostate specific antigen done by blood tests. If your PSA is less than 2.5, you should be checked every 2 years. If at age 50, if your PSA is greater than 2.5, you should be getting it checked every year. African American males are at more risk. And just please remember that if your father or brother has prostate cancer, that doubles your risk. So those are the big take home. As always, stay, your health, obesity, smoking, those are increase your risk for all type of cancers. Obesity, smoking. Now we're saying that there studies also show that dairy increase your risk for prostate cancer and high calcium levels. So be careful that you're not taking, your calcium's not elevated. You're not taking calcium supplements. Firefighters being exposed to the chemicals they're exposed to, anyone exposed to Agent Orange, just get on top of it. This was just a short, information piece to share with all our men out there. Stay on top of it. You can't, what you don't know, you don't know. So here it is. That's just a starter. Prostate cancer is very treatable. I didn't want to go into treatment. I want to, let's at least talk about prevention. All right, spread the word. It's Prostate Cancer Awareness Month. Thank you all for joining me on the Healthful Podcast. Continued blessings to you all. Thank you for listening to the Health Flow Podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram @thehealthflow, also on Facebook @thehealthflow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.